Hello, welcome to sonography-radiology training channel. This series of videos is about basic radiology learning for beginners and non-radiologists. This is the first video in this video series with title of Familiarity with Imaging Modalities Part 1. What is the outline of this presentation? First, history and evolution of radiology. In second part, familiarity with conventional radiography or plain films, familiarity with computed tomography or CT, and final teaching points. The first section is history and evolution of radiology. In 1895, Wilhelm Röntgen, working in a darkened laboratory in Würzburg, Germany, noticed that a screen painted with fluorescent material and located a few feet away in the same room as a cathode ray tube he had energized and made light-proof started to glow or fluoresce. After repeating the experiment, he recognized that the screen was responding to the nearby production of a form of energy transmitted invisibly through the room. He named the new rays X-rays using the mathematical symbol E for something known. It did not take long before almost everyone was taking X-rays of almost everything imaginable. For example, this image is related to Nikola Tesla's foot on an X-ray image taken by himself on a device of his own design in 1896, only 1 year after X-ray's discovery by Röntgen. Like today, conventional radiographic images, usually shortened to X-rays, were produced by a combination of ionizing radiation and light streaking a photosensitive surface, which in turn produces a latent image that is subsequently processed to become visible. For about 100 years after the discovery of X-rays, radiographic images survived their birth as a burst of ionizing radiation by resting comfortably on a piece of a film. At first, the processing of films was carried out in a dark room containing trays with various chemicals, and the films were then literally hung up to dry. When an immediate reading was requested, the films were interpreted while still dripping with chemicals, and the term wet reading for a stat interpretation was born. Films were then viewed on light view boxes, almost always backward or upside down if the film placement was being done as part of a movie or television show. In a few places, film is medium still used, but it's much less common because it has some major drawbacks. It required a great deal of physical storage space for the ever-growing number of films. Even though each film was very thin, many films in thousands of patients' folders took up a great deal of space. The other drawback was that the radiographic films could physically be only in one place at a time, which was not necessarily where the image be needed to help in the care of the patient. Eventually, digital radiography came into being, in which the photographic film was replaced by a photosensitive cassette or plate head could be processed by an electronic reader, and that image could be stored in a digital format. This electronic processing no longer required a dark room to develop the film or a large room to store the films. Countless images could be stored in the space of one spinning hard disk on a computer server. Even more importantly, the images could be viewed by anyone with the right to do so anywhere in the world at any time. The studies were maintained on computer servers on which the images could be archived for posterity, from which they could be communicated to others and in which they could be stored. This system is called a PACS system for Picture Archiving, Communications and Storage System. With PACS system, images from all modalities can be stored and retrieved, including conventional radiographs, CT scans, ultrasound images, and any other imaging modalities. The other section of this presentation include familiarity with conventional radiography or plain films. Images produced through the use of ionizing radiation, that is, the production of X-rays, but without added contrast material like barium or iodine, are called conventional radiographs or more often plain films. The major advantage of conventional radiographs is that the images are relatively inexpensive to produce, can be obtained almost anywhere with portable or mobile machines, and are still the most widely obtained imaging studies. Radiographs require a source to produce the X-ray or X-ray machine, a method to record the image, for example, a film, cassette, or photosensitive plate, and finally a way to process the recorded image either with chemical or a digital reader. Common uses of conventional radiography include the ubiquitous chest X-ray, plain films of the abdomen, and virtually every initial image of the skeletal system to evaluate for fractures or arthritis. The major disadvantage of conventional radiography are the limited range of densities it can be demonstrated and its reliance on ionizing radiation. Conventional radiography is limited to demonstrating 5 basic densities arranged here from less to most dense. The first one is air, which absorbs the least X-rays and appears blackest on conventional radiographs. As we can see here, air in the lung parenchyma reveals blackest in this image. The second density is fat, which is a lighter shade of gray than the air. As we can see here, the subcutaneous fat layer, which is lighter than the air in the lung parenchyma. Soft tissue or fluid, both fluid, for example blood, and soft tissue, for example muscle, have the same density on conventional radiographs. It's impossible to differentiate the heart muscle from the blood inside of the heart on a chest radiograph. Another density is calcium, the most dense naturally occurring material, for example bones, absorb most X-rays. And 5. Metal, which appears the whitest on radiograph. Of course, metallic densities are not normally present in the body. And we can see here a foreign body aspiration by a child in the esophagus. Radiographic contrast media and prosthetic knees or hips are examples of metallic densities artificially placed in the body. Although conventional radiographs are produced by ionizing radiation in relatively low doses, radiation has the potential to produce cell mutations that could lead to many forms of cancer or anomalies. Public health data on lower levels of radiation vary as to their assessment of risk, but in general, only medically necessary diagnostic examinations should be performed, and studies with X-ray should be avoided during potentially teratogenic times such as pregnancy. Now, familiarity with computed tomography or CT. CT or computerized axial tomographic scanners, first introduced in the 1970s, brought a quantum leap to medical imaging. With the use of a gantry with a rotating X-ray beam and multiple detectors in various arrays, which themselves are rotating continuously around the patient, along with sophisticated computer algorithms, to process the data. A large number of two-dimensional slice-like images, each 1 millimeter in size, could be formatted in multiple imaging planes. The CT scanner is connected to a computer which processes the data through various algorithms to produce images of diagnostic quality. A CT image is composed of a matrix of thousands of tiny squares called pixels, each of which is computer assigned a CT number from -1000 to +1000, measured in something called Hounsfield units, after Sir Godfrey Hounsfield, the man credited with developing the first CT scanner, for which he won the Nobel Prize in Medicine in 1979 along with Alan Cormack. The CT number will vary according to the density of the tissue scanned and is a measure of how much of X-ray beam is absorbed by the tissues at each point in the scan. By convention, air is assigned a Hounsfield number of -1000 and bone is about 400 to 600 Hounsfield or maximum to +1000. Fat is about -40 to 100. Water is 0 and soft tissue varies from 20 to 100. CT images are displayed or viewed with a range of Hounsfield numbers pre-selected to best demonstrate the tissue being studied, and anything within the range of CT numbers is displayed over the levels of density in the available grayscale. This range of displaced density is called the window. As we can see in this image, pulmonary parenchyma window, mediastinal window in these images, brain parenchyma window, and bone window. Denser substances that absorb more X-rays have high CT numbers. They are said to demonstrate increased attenuation and are displayed as wider densities on CT scan images. On conventional radiographs, these substances like metal and calcium would also appear wider and be said to have increased density or be more opaque. Less dense substances that absorb fewer X-rays have low CT numbers. They are said to demonstrate decreased attenuation and are displayed as blacker densities in CT images. As we can see here, the lung parenchyma, which contains air, we can see here as black densities. On conventional radiographs, these substances like air and fat would also appear blacker and be said to have decreased density or increased lucency. CT scans can also be windowed in a way that optimizes the visibility of different types of pathology after they are obtained, a benefit called post-processing that digital imaging in general markedly advances. Post-processing allows for additional manipulation of the raw data to best demonstrate the abnormality without repeating the study and without re-exposing the patient. As we can see in this clip, we can change the window from mediastinal window to bone window, and also we can change another one to pulmonary lung window. Traditionally, CT images were viewed mostly in the axial plane. Now, because of volumetric acquisition of data, CT images can be shown in any plane, include axial, sagittal, and coronal sections. Volumetric data consists of a series of thin sections that can be reassembled for a 3D reconstruction. Surface and volumetric rendering in the 3D can produce CT images of amazing realistic quality. As we can see here in this clip, we changed the image to 3D volume rendering of bony tracts. We can rotate the image and different in various views. We can magnify or minimize the image. One of the major benefits of CT scanning over conventional radiography is its ability to expand the grayscale, which enables us to differentiate many more than the 5 basic densities available on conventional radiographs. Because of increasingly sophisticated arrays of detectors and acquisition of hundreds of slices simultaneously, multi-slice CT scanners permit very fast imaging, for example from head to toe in less than 10 seconds. That has allowed for development of new applications for CT such as virtual colonoscopy, virtual bronchoscopy, cardiac calcium scoring, and CT coronary angiography. These examinations can contain thousands or more images, so that the older methods of filming each image for study on a view box became impractical, and such examinations are almost always viewed on a computer workstations, where it is possible to study many images only by scrolling. CT scans are the cornerstone of cross-sectional imaging and are widely available, although not as yet through portable. As with conventional radiography, CT scanners are also used ionizing radiations or X-rays to produce their images. Now, please pay attention to these final teaching points. Today, almost all images are stored electronically on a picture archiving and communication systems called PACS. Conventional radiographs or plain films are produced with ionizing radiations generated by X-ray machines and viewed most commonly on a monitor. Such X-ray machines are relatively inexpensive, are widely available, and can be made portable. The images are limited as to the range of densities and therefore the scope of findings they are capable of displaying. There are 5 basic radiographic densities arranged in order from the which is displayed the whitest to that which is displayed as the blackest. Include metal, calcium or bone, fluid and soft tissue, fat, and finally the air, which is blackest. CT uses rapidly spinning arrays of X-ray sources and detectors and sophisticated computer processing to increase the range of densities visible and display them in any geometric plane. CT scanners have become the foundation of cross-sectional imaging. They are moderately expensive and also use ionizing radiation to produce their images. Now, I suggest 2 others of my videos that are close to this video in terms of matter. And thank you for your attention.